Hello, my name is Kate Davison. I am a Gilbert Postdoctoral Career Development Fellow at the University of Melbourne. Today I will be presenting my talk for the symposium Sexual Violence, Medicine and Psychiatry, co-hosted by the Sexual Harms and Medical Encounters group at Birkbeck and the University of Newcastle in New South Wales. The title of my talk is Paraphilia or Harmful Sexuality, explaining the absence of the victim in early clinical research into rape and paedophilia. In 1990, the psychiatrist Neil McConaughey was invited by SBS television in Australia to participate in a discussion about the treatment of rapists and child sex abusers. The discussion was being held in response to the airing of a documentary by the award-winning Canadian filmmaker John Zaritsky called Rapists, Can They Be Stopped? It was made in 1986, but not widely seen until 1989. It presented the stories of 5 men convicted of rape, usually multiple rapes, often involving children, and one even ending in murder. These 5 men were all participants in a special sex offenders treatment program at the Oregon State Hospital, a prison facility in the United States. At the time, this was one of 6 programs experimenting with the use of Depo-Provera and other techniques, but at Oregon, they were also deploying techniques such as aversion therapy, whereby the offender would be shown various pictures or moving images, and if he had an erotic reaction to them, he would have ammonia squirted up his nose. Aside from such individual treatments, a key focus of the program was victim awareness, including what the program leaders called victim awareness days. This included group sessions in which program participants would be made to listen to police emergency call recordings of rapes, but it also involved face-to-face confrontation sessions with women who had been raped. These women would volunteer to come and tell the offenders what they felt and thought. The film includes footage of one of these sessions, showing one woman giving an offender a piece of her mind. You know what? You think about what our system does for you. You are in here getting help. You're in here getting counselling. What's the victim do? If we get counselling, we pay for it ourselves. We are paying for your counselling. McConaughey was invited to comment on the film by SBS television in Australia due to his recognised expertise in the treatment of sex offenders, but more generally as a psychiatric expert on all issues to do with sexuality, desire and sexual behaviour. He joined another guest, Jocelyn Scott, a high-profile feminist lawyer with a specialisation in rape and domestic violence. McConaughey had not yet seen the film, but SBS sent him a copy on VHS, along with some press reviews. The handwritten notes he took while watching the film, which he kept in his personal papers, are revealing about his reaction to what was presented about the Oregon State Hospital program. Overall, these notes suggest deep skepticism, the reasons for which hopefully will become clearer by the end of this talk. What I want to focus on here is the attention to and the utilisation of victim experiences. These days, when we talk about rape and paedophilia, it's customary for victims and survivors to be at the forefront. This is particularly the case when considering the psychological effects of these crimes. In fact, it's difficult to imagine a discussion about child sexual abuse taking place today without centering the psychological effect of this crime on its victims. There is even some frustration that the overwhelmingly male perpetrators get left out altogether, in the sense that when it comes to solving the problem of rape, the proposed solutions still typically focus on what women and children can do to avoid it, rather than what men should do in order to not become perpetrators in the first place. My reading of medical, psychiatric and sexological literature from the 1950s and 1960s shows that this was not always the case, particularly concerning a range of issues considered at the time to be paraphilic. These included homosexuality, fetishism, transvestism, voyeurism, exhibitionism, and paedophilia. The focus then was very much on figuring out whether such paraphilias could be corrected or eradicated altogether. That is, the therapeutic literature focused on those who presented with these paraphilias, not the objects of their desires. One reason for this is that in defining paraphilias or sexual disorders, harmful and non-harmful forms of non-normative sexuality were all lumped in together, as though they were all merely variant manifestations of sexual neuroses. No distinction was drawn between non-normative sexuality that was consensual and non-harmful on the one hand, and sexualized violence and harassment on the other. This was also true of the penal system. For example, a study conducted between 1955 and 1957 at the Oregon State Hospital, investigating the IQs of 112 convicted sex offenders, included men convicted of homosexual activities alongside those serving sentences for indecent exposure, rape, including sodomy, statutory rape, and something called delinquency. Out of 112 cases, 90 involved an offence against a child, 72 of which against a girl. Only 2 out of the 112 cases involved homosexuality. In the medical literature of the 1950s, however, adult heterosexual rape seems conspicuously absent from professional therapeutic debate on so-called sexual disorders. In this talk, I'd like to begin tracing the early absence and later entry of notions of rape, sexual abuse, trauma, and survivor experience in psychiatric discourse on the diagnosis and treatment of sex offenders. What I'm exploring in this talk arises from my research on the history of aversion therapy, especially but not exclusively in its use in the treatment of homosexuality. In my research, I have looked in detail at early post-war clinical investigations of same-sex desire and the testing of behavioural therapeutic methods to alter, change, or suppress it. My research has mostly focused on 2 psychiatrists, the Czechoslovakian Kurt Freund, who you can see on the right, who until 1968 was based in Prague, and from 1969 until his death in 1996 was based in Toronto, Canada. And Neil McConaughey on the left, who was based in Sydney from 1964 until his death in 2004. Both Kurt Freund and Neil McConaughey devoted the first decades of their respective careers in the 1950s and 1960s to researching the topic of homosexuality and its treatment, and whether it could be corrected using Pavlovian conditioning or aversion therapy. They conducted the 2 largest and longest clinical experiments in the field and maintained a friendly professional relationship. And in fact, they were, I would say, friends. Freund produced a monograph, Homosexuality in Men, which appeared in Czech in 1962, and a few months later in an author-authorized German edition, based on data gathered from 222 male homosexual patients aged between 18 and 64 that were gathered cumulatively between 1950 and 1957 and then followed up longitudinally. In the mid to late 1970s, shortly after homosexuality was removed from the Diagnostic and Statistical Manual and its various equivalents, both psychiatrists shifted their focus from the treatment to the treatment of harmful sex crimes, namely rape, with a special focus on paedophilia. This shift paralleled an increasing tendency, especially within law reform discourse, to describe consensual homosexual acts between adults as a victimless crime. For Freund and McConaughey, the shift was a relatively simple one to make. Why it was so simple is the focus of this next section of my talk. Freund and McConaughey's earlier work on homosexuality had not been in vain. On the contrary, one of the central questions of that early research concerned the links between age and erotic attraction. As noted earlier, research into the diagnosis of paedophilia was often carried out in tandem with, or in fact, most of the time was indistinguishable from, research into homosexuality. Freund and McConaughey were 2 of the earliest psychiatrists to successfully develop empirical methods to clinically diagnose male erotic attraction in the 1950s and 1960s. For this research, specially designed clinical machinery measuring volume response in the penis, called a penile plethysmograph, was used in conjunction with visual imagery, both pornographic and non-pornographic, and much of it depicting minors, particularly in the case of Freund. In the case of McConaughey, it was less so. And I just throw in a side note here, the production of this pornographic, or this photographic material rather, for clinical use, itself raises further questions about the subjects of those photographs and their vicarious exposure to sexual abuse. Freund noted in 1958 that one of the limitations of his experiment was the fact that only static stimuli were available, so that it was not possible to make sufficient use of the erotic effect of movement and behaviour. And that last part was a quote. Having established a mechanism for diagnosing disordered erotic preferences among men, they then conducted extensive experiments using aversion therapy to see whether the diagnosed sexual object preference could be clinically reoriented. The primary focus of this research was male same-sex desire, yet at various points their subject cohorts included heterosexual controls. Freund in particular was very interested in trying to determine the role of age, both the age of his patient subjects and the age of their preferred sexual objects. His monograph included a section on preferred partner age of his subjects. Based on plethysmograph results, Freund identified distinct categories of lower and upper age limits when choosing a partner. In one study carried out in the mid-1950s, 42 almost exclusively homosexual men were compared with 40 almost exclusively heterosexual men. A key finding of these studies was that homosexual orientation was not a defining feature of pedophilic interest. It was detected in roughly even amounts between homosexual and heterosexual study subjects. As noted, after the removal of same-sex attraction from the Diagnostic and Statistical Manual in 1973, both Freund and McConaughey shifted the focus of their therapeutic experiments to diagnosing and treating rapists, especially pedophilic rapists, irrespective of their gender orientation. The diagnostic method developed by Freund in the 1950s and extended by McConaughey in the 1960s to empirically determine male erotic attraction turned out to be one of the most important tools in special sex offender programs in the 1980s and 1990s. Both Freund and McConaughey went on to become leading experts on the treatment of pedophiles and rapists, including frequent appearances in court and providing testimony to various royal commissions. Yet in the medical literature detailing the methods and results of their experiments, terms like abuse, rape, and trauma, and indeed the patient's victims themselves, are virtually absent before the 1980s. It was not until a broader discussion emerged in the wake of the feminist movement that began to focus on women's and children's experiences of rape that such considerations entered psychiatric discourse. This is not a new observation. Among others, the historian Jan Hendrik Friedrichs has noted in his study of German debates around pedosexuality, as it's known, and intergenerational sex, that this shift can be explained by the growth of a feminist discourse demanding attention to the issue of violence in general and sexualized harm and violence in particular. Stephen Angelides, in his recent book, The Fear of Child Sexuality, which traces various aspects of public and political discourse around children, sex, juvenile desire, pedophilia, and other associated themes, argues that children's sexuality scarcely existed as a concept until the 1970s. Much attention is given to the 1980s sex panics around child abductions and pedophilic predators, yet it seems, as Friedrichs has noted, that these panics were, in one sense, an outcome rather than a cause of attention to victims. The more significant factor here, then, seems to be the rise of a feminist critique around interpersonal violence. McConaughey came to express the view that treatment programs such as those in Oregon in the 1980s and 1990s were mismanaging the question of consent and their apparent attention to victims was off. In my reading of the 1950s and 1960s medical literature, I think that there are two forces at play. One is that until the emergence of 1970s feminist discourse, which strengthened in the 1980s, calling for a focus on harm and violence, particularly in the area of law reform and anti-discrimination, there was no effective distinction in the medical and psychiatric establishment between harmful and non-harmful sexuality. And in this context, it's hardly surprising that such a concept as the victim of pedophilic rape did not exist. Secondly, and building on the first point, rather than there being a distinction between harmful and non-harmful sexuality, where consent of all partners is the central criterion, the medical and psychiatric definitions were along the lines of normative and non-normative sexuality. Pedophilia became the subject of research because of its association with homosexuality. And I should note here that one of the strongest theories was the theory of the seduction of minors. But here, the focus was not on the potential psychological harm that that sex with minors would have on those children or young people. Rather, the concern was that it might turn them into homosexuals. What the research of psychiatrists such as Kurt Freund and Neil McConaughey showed was that this association between homosexuality and pedophilia was not sustainable. Returning to McConaughey's reaction to the documentary, rapists, can they be stopped? As I mentioned earlier, the handwritten notes he kept give a strong indication of his skepticism. He noted several what he called disturbing aspects of the Oregon program, including the fact that participants were under pressure to appear to respond. If they could convince the therapist of their sincerity by being tearful and crying, especially when confronted by victims, then they could achieve early release from prison and be sent back into the community. He questioned the therapeutic value of making them the target of victim hostility, especially when they had previously made repeated statements that they had done what they had done because they felt like nothing. Rape had made them feel like someone. Rather than turning them off rape, listening to police tapes might rather have the effect of reinforcing their feelings. And he complained that their responses to photographs and videos was being tracked through the use of a strain gauge, which measured circumference changes in the penis rather than volume changes. Strain gauges were easier to fake with muscular control. Finally, and most disturbingly, the so-called victim awareness classes ignored the fact that a vast majority of rapes were date rapes. Emphasising empathy with victims' experiences was next to useless. These criticisms took more concrete form in a published article in 1997 called Science and the Mismanagement of Rapists and Pedophiles. Not only was the unscientific use of unreliable tools perpetuating the mismanagement of abusers, years of experimentation with homosexual aversion therapy had failed to alter sexual orientation and had shown that any increased ability to control sexual urges was not due to conditioning. Despite this, he complained, the use of aversion procedures had persisted in North America in particular. Abusive or harmful orientations were probably permanent and would remain resistant to change. Freund, too, had reached this view. More disturbingly, complained McConaughey, there was no evidence that attempts to correct offenders' faulty cognitions by simply asserting the opposite view was an effective treatment strategy. That is, trying to address rapists' beliefs that women can mean yes when they say no, and pedophiles' beliefs that sexual abuse of children is not harmful, simply by telling them that they were wrong. The occasional and context-specific reality that a woman could possibly mean yes when she uttered the word no could be acknowledged, but offenders had to be told that they could never use such a reality, if it were ever true, to justify their behaviour, and that children, whatever the case, could never, ever give informed consent. In a new context, then, informed by feminist discourse on sexual violence and harm, McConaughey and Freund's early research on homosexuality provided crucial empirical grounds for them to urge the psychiatric profession to raise the scientific quality of research and alter its therapeutic approach to abusers in order to minimise harm to potential victims. Thank you very much.